Bismillahirrahmanirrahim. He who the quote of the day is he who has health has hope and he who has hope has everything. A quote by Thomas Carlyle. Today the topic of presentation is primary health care under the supervision of Professor Dr. Saira Afzal. The learning outlines of today's presentation is definition of primary health care, Alma Ata Declaration, selective primary health care, health, uh, health for all by the year 2000, philosophy and strategy of primary health care, key elements, principal components, advantages and constraints of primary health care, and recent advances, and at the last are the MCQs. By the end of this presentation, participants will be able to describe what is primary health care and selective primary health care, philosophy and strategy of primary health care, key elements, principal components, advantages, constraints, and structure of primary health care. In 1977, the Director General of WHO called for a new strategy that acknowledging that although the healthcare strategies of the industrialized world, that of big hospitals, drugs, and curative medicine had been exported to developing countries for 30 years. The health of the world had not improved yet. The International Conference of Primary Health Care was convened in Almaty at Kazakhstan in 1978. Was attended by virtually all the member nations of the WHO and UNICEF, and it becomes a core concept of the WHO's goals of health for all by the year 2000. Now the definition of primary health care. Primary health care is essential health care that is made universally accessible to individuals and families in the community by means acceptable to them through their full participation and at a cost that the community and country can afford. It forms integral part both of the country's health system, of which it is the nucleus, and of the overall social and economic development of the community. On the brief concept of health for all. It was prescribed in 1977 by the World Health Assembly 30th World Health Assembly that launched a movement Health for All by the year 2000. They defines health for all as the attainment by all peoples of the world by a particular date kept at that time as the year 2000 of a level of health that will permit them to lead a socially and economically productive life. It sets the following guideline targets. Number one target is that the life expectancy at birth will be above 60 years and infant mortality rate below 50 per thousand live births and under 5 mortality rate below 70 per thousand live births. Now the selective primary health care. It was advised in 1979 by Rockefeller Foundation in Bellagio Conference Center, Italy, and it was inspired on a paper by Julia Walsh and Kenneth S. Warren that entitled Selective Primary Health Care: An Interim Strategy for Disease Control in Developing Countries. Now, the selective primary healthcare framework advocated more economical, feasible approach to primary healthcare by only targeting specific areas of health and choosing the most effective treatment plan in terms of cost and effectiveness. Now, the example of a selective primary healthcare. The UNICEF proposed a selective approach which emphasizes on maternal and child health according to the GOBI FFF, which indicates the growth monitoring, oral rehydration, breastfeeding, immunization, female education, family spacing, and female supplementation. By implementing it in Africa, the infant mortality rate has been declined to 40% in 10 years. Now, the philosophy of primary health care. Health is related to the availability and distribution of resources, and health resources, socio-economic resources. Therefore, primary health care is concerned with equity, which means that available health and social resources are distributed justly with due consideration for those in greatest needs. Health is an integral part of overall development. The social, culture, economic, environment, and biological factors all play a role. Achievement of better health requires involvement of individual families and communities by adopting health behavior and healthy environment. On the primary healthcare strategy. The primary healthcare strategy needs for a change in healthcare system. This means that the allocation of health resources will be carried out according to the needs and intersectoral action for health, individual and collective responsibility for the health. Now, the five key elements of primary health care. The ultimate goal of primary health care is the attainment of better health services for all. It is for this reason that the WHO has identified five key elements to achieving this goal. Number one element is reducing exclusion and social disparities in health, organizing health services on people's needs and expectations, integrating health into all sectors, and pursuing collaborative models for policy dialogue. And the last one is increasing stakeholder participation. Now, the principles that guide primary health care. A series of basic principles are identified in Alberta Declaration that should be formulated in national policies in order to launch and sustain primary health care as part of a comprehensive health system and in coordination with other sectors. The number one principle is equitable distribution of health care. According to this principle, primary care and other services to meet the main health problems in the community must be provided equally to all individuals irrespective of their age, gender, caste, color, urban rural location and social classes. Second principle is community participation. In order to make the fullest use of local, national and other available resources, community participation was considered sustainable due to its grassroots nature and emphasis on self-sufficiency as opposed to targeted approaches dependent on international developmental assistance. Third principle is health human resource development. Comprehensive healthcare relies on an adequate number and distribution of trained physicians, nurses, allied health professionals, community health workers, and other working as a health team and supported at the local and referral levels. Fourth principle is the use of appropriate technology. Medical technology should be provided that is accessible, affordable, feasible, and culture acceptable to the community. For example, the availability of a refrigerator in a basic health unit will give much benefit to the community, while sophisticated machinery such as CT scans and other cardiovascular machines will help only a less number of people in the community. So the medical technology should be given to those from which maximum number of people can get benefit. And the number fifth and last principle is multi-sectoral approach. Recognition that health cannot be improved by intervention within just the formal health sector, other sectors are equally important in promoting the health and self-reliance of communities. These sectors include at least agriculture, education, communication, health problems, and the methods of preventing and controlling them, housing, public works, rural development industry, community organizations, and local governments and voluntary organizations. So the components of primary health care. There are eight main components of primary health care, and the number one component is education about common health problems that what can be done to prevent and control them. Second one is maternal and child health care, including family planning. Third one is promotion of proper nutrition and food supply. Fourth one is immunization against major infectious diseases. Fifth one is an adequate supply of safe water and basic sanitation. Sixth one is prevention and control locally endemic diseases. Seventh is appropriate treatment of common diseases and injuries, and the eighth is basic laboratory services and provision of essential drugs. There are other there are also other five components that are training of health guides, health workers and health assistants, referral services, mental health, physical handicaps, and health and social care of elderly. Now the basic requirements of primary health care. In basic requirement, there are 8 A's and 3 C's. In 8 A's, there is appropriateness that the healthcare should be provided by the appropriate healthcare professionals, and it should be appropriate to the proportion of the people in the community, and it should be available to all the persons in the community. It should be educate, and according to the persons in the community, it should be accessible to all the persons in the community in terms of social, culture, political beliefs, and religious beliefs, and it should be acceptable for all the members in the community. It should be affordable for the community members as well as for the country. It should be easily accessible. It should be reachable, and should be accessible in terms of social, cultural, political uh, beliefs. It should be accountable, and it should be completeness. Completeness refers to that all Healthcare facilities, for example, in diagnosis, curative, preventive, and rehabilitative services should be given, and comprehensiveness and the continuity of services, that the services should be available whenever they are required. Now, the primary healthcare is an approach that focuses on person, not disease. It considers all determinants of health. It integrates care when there is more than one problem, uses resources to narrow differences, forms the basis of other level of health system. It addresses more important problems in the community by providing preventive, curative, and rehabilitative services, organizing deployment of resources, aiming at promoting and maintaining health. Now there is a flowchart diagram of primary health care which shows the preventive and curative services. In preventive services, there are general services. In general services, there is health education of the health staff, environmental monitoring, prevention and control of endemic diseases, and health office services. And the care of vulnerable groups, in which the care is given to the mothers and the child. School health services that are given in Pakistan by the school and nutrition supervisors in BHUs and RICs, geriatric health services, and occupational health services. In curative services, care is given at the outpatient clinics, and the care can get given at the laboratory investigations, at the dispensaries, and first aid emergency services. Now the primary healthcare advantages. Primary healthcare better access. It has a better access because services are provided among the community. It is cost effective than hospital care. It improved communication service seekers and service providers. It is educate primary healthcare provision, obviate the need of a more specialized healthcare. On the constraints in primary healthcare. Number one is the political climate. Um, Due to the political differences, much of the budget of the country in Pakistan is addressed towards the defense and the debt, and the remaining much less proportion of the budget is given to the primary health care. Disregard of human rights, political commitment, and lack of appreciation of multifaceted approach. The structure of healthcare delivery system. The healthcare services are provided to cater different diseases of varying intensities. Hence the level of healthcare needed varies. The healthcare delivery can be categorized into three levels: primary healthcare, secondary healthcare, and tertiary healthcare. The care needed by the individuals varies among the different individuals. For example, a person at risk of developing coronary heart disease, he had to seek the preventive services, while the person who has developed the coronary heart disease, he will seek the curative services. So the level of healthcare needed varies among different individuals. Now the primary healthcare. It is the level of contact of individuals, the families, and the community with the healthcare system, bringing healthcare as close as possible to where people live and work, and constitute the first element of continuing healthcare process. The first level of contact between the individual and a health system. It is the essential healthcare. In it, the essential healthcare is provided. A majority of prevailing health problems can be satisfactorily managed. It is closest to the people, and it is provided by the primary health centers. Now, the Alma Ata Declaration recommended that primary health care should evolve from economic, social, culture, political conditions of the country and its communities. Primary health care is for the people and by the people. It addresses main health problems in the community, provide promotive, preventive, curative, and rehabilitative services. It includes health education, food and nutrition, educate, water supply, basic sanitation, maternal and child health, family planning, immunization, prevention of local endemic diseases, treatment of common diseases, and provision of essential drugs. It should include all the sectors affecting the health. It promotes maximum community self-reliance and participation, be sustainable and integrated with referral systems, and it rely on all cadres of health workers. No secondary health system. It is more complex. In it, more complex problems are dealt, like the obstetrical care, or the person that needs surgery, or the ENT or eye care, They will be dealt in the secondary healthcare facilities, as these facilities are not available at primary healthcare levels. It comprises curative services, and in Pakistan, it is provided by the Tehsil headquarter hospital and district headquarter hospitals. Now the tertiary healthcare care. It offers super specialist care, like the person which needs neurological healthcare or the urological healthcare. He will this care will be provided to the tertiary healthcare, and it is provided by the regional center level institutes, and it provides training programs for the doctors, nurses, and other health staff. Now the primary healthcare in Pakistan embarked on primary healthcare services provision for the poor prior to the 1978 Alma-Ata Declaration of the Health for All by the year 2000. By the 5th and 6th year plan during the 1978 to 1983, 492 RSCs were built out of 625 and 3496 BHUs were built out of 4596. Primary healthcare provides a link between villages that are marginalized population and the whole health system. Now the basic health units. These are the components of primary health care. It serves a population of about 5,000 to 10,000 population. Services provided in basic health units are mother and child health care services, child care, immunization, diarrheal disease control, malaria control, child spacing, mental health, and school health services. Outreach services will be provided primarily for mother and child health through training of birth attendants. 5 to 10 BHUs will be linked to a RSC. Now the rural health centers that are also the component of primary health care. In it, about 25 patient beds are available. Laboratories will be available for diagnosis of different diseases. X-ray machine is available, and the provision of minor surgery facilities are available, and a dentist is available in RSC. RSC is linked to THQ, which is then linked to the DHQ. The whole system of BHU, RSCs, THQs, and finally the DHQ is designated as Integrated Rural Health Complex. On the primary healthcare planning, the key concepts in primary health planning are equity, effectiveness, and efficiency. Equity. Everyone should be entitled for healthcare. His needs should be taken into consideration. Together, both the statements mean that everyone should be provided care as per their needs, as everyone's needs are not equal. Providing services to people according to their needs is important. However, without efficiency and effectiveness, they fail to have an impact. Know the effectiveness. Each primary healthcare program activity such as EPI should have its impact measured through various indicators. Effectiveness lacking in equity and efficiency would mean loss of desired force of effectiveness. Efficiency. Whenever primary healthcare programs are undertaken, they should be low cost and consistent with favorable effect. To have efficiency without equity and effectiveness means inaccessibility to large sections of population to obtain desired results. The term for recent advances. Number one article is effectiveness of telephone-based screening and triage during COVID-19 outbreak in the promoted primary healthcare system, a case study in Erbil province in Iran. The aim of the current study was to evaluate the telephone-based screening and triage services in the promoted primary healthcare system with regard to COVID-19 outbreak in terms of reducing unnecessary referrals to the hospital. Methodology. In the first stage, it is conducted by trained health care providers through telephone. Individuals suspected of COVID-19 were identified. In the second stage, individuals were referred to second level of service in comprehensive healthcare centers for clinical evaluation by a physician. The results of this study. The results showed that before establishing a screening and trial system for patients in comprehensive healthcare centers, all patients were referred directly to the hospital, while after the implementation of program, a significant reduction in hospital visits was observed, and a large number of patients undertook the care and triage services in comprehensive healthcare centers. Second article is incorporating group medical visits into primary health care. Are there benefits? The main points of this study is the purpose of this paper is to report whether group medical visits have tangible benefits for providers and and patients. This report shows that there are tangible benefits in delivering group medical visits in primary health care. While whole patient panels can benefit from the integration of group medical visits into practice, those who could gain the most are patients with complex medical and social needs. Group medical visits provide an opportunity to enhance primary health care, strengthening the system, particularly for patients with chronic conditions. Now the time for MCQs. First MCQs, what distinguishes primary health care from hospital care? A option is high level of care provided by specialists, provision of intervention specific to the health need, works within the multidisciplinary framework, or the planning and operation of services is centralized.
B.
C is the correct option. C is the correct option because in primary health care, there is a multidisciplinary approach or intersectoral approach in which multiple sectors and multiple disciplines work together. Second MCQ is comprehensive primary health care is characterized by activities that work to change social and political determinants of illness, economic and education well-being, health status in communities, regions or cities, or all of above.
D. C.
D is the right option. Comprehensive primary health care includes uh, all of these dimensions. Third MCQ is the primary health care in the health system is the dash as compared with other levels of care. Whether it is less costly for the community and the system, less costly for the community but not for the system, most costly or same costly.
A.
Yes, A is the right option because it is less costly for the community and as well as for the system. Fourth MCQ is a 4-year-old child has high-grade fever, mechanical rash on body, cough, coryza, and conjunctivitis. Isolation of this child belongs to what level of healthcare, whether it is primary, secondary, or tertiary healthcare, or specialized healthcare.
C.
Primary healthcare is the correct option because locally endemic diseases and curative services are provided in primary healthcare. Primary healthcare is a total approach to community development. Which of the following is not an indicator of success in the use of primary healthcare approach, whether it is accessibility, acceptability, appropriateness, or inequity?
D. D.
Yes, inequity is the correct option because in primary healthcare there is the equity. A 55-year-old male has productive cough for 4 weeks along with low-grade fever and night sweats. The first contact of this person with health system will be whether it is primary healthcare, secondary healthcare, tertiary healthcare, or specialized healthcare.
A. A. Primary healthcare.
A is the correct option. The government has allocated a budget for the new construction of BHU in a district. The ideal location for BHU will be near to a THQ hospital so that referral patients can be easily shifted there, or near to a community of 20 houses living far away from a city so that healthcare facilities can reach there, near to a river so that emergency drowning cases can be dealt there, or near to a well set up colony of 7,000 residents. Yes, D is the correct option because in primary healthcare, the services are provided on the basis of equity. A person came to hospital with a wound on his head, which is actively bleeding. His history reveals that he had this wound while he was fighting on a roadside with a person who hits his car and had killed the other person. The doctor on duty should have to first call the police. No treatment should be given to this criminal, or best possible health care should be given to him or inform the hospital administration.
C. A.
C is the right
C.
option because healthcare services should be provided irrespective of the age, gender, ethnic groups, or from where the person belongs. These are the references of the presentation. Thank you very much.
Okay, thank you very much, Dr. Awais. It is a good presentation. Now we should have our internal discussion. Please off the recording.
Okay, ma'am.